Michelle is a great patient. She is young, she's 45 years old. She has no other major GYN problems. Her main issue is that she's had breast cancer. So she's a breast cancer survivor. And in those patients, high estrogen puts them at risk for breast cancer recurrence. So a lot of times they'll undergo a hysterectomy to prevent ovarian cancer, to lower their estrogen, to improve their odds of survival with breast cancer.
So I called Dr. Cousins, said I want a hysterectomy. He did the biopsy, that came out good, did an ultrasound, and that came out good, and he explained to me that I was a good candidate for the single site.
We won't know until Michelle's asleep. We'll make our decision once I look in the belly. Once I look, then we'll decide single site or standard robotic surgery. Either way, robotic surgery done single site or multi-port is superior to abdominal surgery, to having an abdominal hysterectomy. Michelle's a perfect candidate for robotics for several reasons. The main one is the goal of this surgery is to remove all of the ovarian tissue that's the source of the estrogen that may feed her breast cancer. Other approaches to hysterectomy and removal of the ovaries may leave a portion of the ovary. Robotic surgery allows us to look places and to dissect places that are difficult and dangerous, particularly with vaginal surgery. You can't see high enough to remove the ovaries above the pelvic brim, so all the way up by the back. So in this case, it's the right surgery for Michelle to completely remove the ovary to lower her risk for breast cancer recurrence. So standard laparoscopy includes multiple incisions. Single site is an effort to put all four of those instruments through one incision, and that was approved for robotic surgery in March of this year. There are about 40 programs in the country offering single site surgery for GYN for benign conditions, and we're one of the first in the state, the second site in the state to do single site GYN and the first to do benign GYN. And Michelle asked me, she said, is it possible that I can go home the same day and really not even go home, but I want to go watch a football game Friday night? Her son is a senior in high school and plays football, and she doesn't want to miss that game. She had her surgery at 7 in the morning. I saw her around noon, and she'd already eaten lunch and told me she wanted to leave the hospital.
Dr. Cousins came in to see how I was doing, and I said, I feel great. Can I go home? And he said, sure.
And she was ready to leave. She said she was leaving. So she did. She left. She went to the football game that night.
I was hyped up, excited to be there. But when I sat for the game, there was 5 minutes before half, I had to get up and I had to stand. Standing was so much better because of where the incision was. So I stood the rest of the game, but I really felt good.
My kids go to the same school, so I have a son that's a freshman and a daughter that is a senior that's the same as her son in the same class. And so I would go to the Wrightstown football games anyway. So we were there at the same game. Now I just knew someone to sit by.
With the single site, I had less pain, and I only had one scar because I went in through the belly button, and the recovery time is a lot faster. As
robotic surgery gains momentum, there are questions about complications and safety and things like that. And what I've seen, because I've been involved with it from the ground floor, being really one of the first to do this, is that's not true. It's safer than any other route of surgery in the right hands. So the surgeon drives the machine, and if you have the right surgeon, then the complication rate should be lower than any other route of surgery. Because there's so many robotic surgeons at Bellin, we've done triple the amount of surgeries that anyone else has. So it is kind of old hat. It is new, single site surgery is new, but robotics in general is sort of old hat. And I mean, people come from all over. In fact, I think that day there were some people that came, an OR crew from another hospital, just to watch how we do it, because they do a great job at it. Dr.
Cousins is wonderful. He's talented with what he does, awesome bedside manner, easy to talk to, great doctor.